Joining me now to talk a little bit about COVID-19, of course, and conditions here in San Juan County from San Juan Regional Medical Center. Dr. Erin Philpott is joining me on the phone this morning. Dr. Philpott, good morning.
Good morning, Scott. Thanks for having me today.
You bet. Thank you for calling in. And I have to say to the audience and to you that Megan Cullip is not available to be here for our interview. We're speaking on Wednesday, and I know she's just mortified that she is missing this opportunity to speak with you. So I just want to put that out there. So she's sorry she can't be here, but I am, and you've got some great information to share with us. So I appreciate you calling in and being part of the program. We wanted to talk a little bit about the news that's been reported this week about the treatment of COVID using convalescent plasma. I know we've talked with you about that before, but what's your latest take on some of these latest developments?
Yeah. Well, first off, thanks for having me
again,
and I'm sorry to miss Megan. So as far as the convalescent plasma goes, as you remember, it's sort of the liquid portion of the blood, and it is taken or donated from patients who have recovered from coronavirus or SARS-CoV-2. Within this liquid portion, there's antibodies that are thought to help neutralize the virus when given to people who are actively or acutely ill with SARS-CoV-2. It's something that's been well studied and utilized since the turn of the century, and I think actually even during the 1918 flu pandemic, if I'm not mistaken, and has been studied in different ways across our country since the start of the COVID-19 pandemic here. The program that we at San Juan Regional were or are, as of I think one more day participating in, is the Expanded Access program through the Mayo Clinic. It gets very confusing, all these different programs, whether it be studies or programs to access medications or, FDA approval formally or the emergency use authorization. But to date, we were participating in this Expanded Access program. As everyone's probably heard or is hearing now, that convalescent plasma has received emergency use authorization through the FDA. So that just means that it has not undergone the usual rigorous FDA sort of screening and assessment process with the normal robust data that is required to get approval of a treatment, but that it was approved considering the risk benefits and probable benefit in coronavirus. So that is going to change things just a little bit for us. There's some arguments that maybe the data is not robust enough quite yet. We haven't seen any really great randomized controlled trials looking at convalescent plasma. The Mayo Clinic Expanded Access trial did manage to enroll. I mean, it was a really great turnout, enroll many, many, many people across the country, and did get some good data from that showing that there is mortality benefit. But again, it's not that usual sort of gold standard randomized controlled trial that we as scientists and physicians so like to see, on which we can base our evidence-based practice of medicine. So more to come on that, but that's where convalescent plasma is at this point in time.
Understood. But it does seem like, at least in some cases, it seems to be a fairly effective part of the treatment process, maybe not the whole treatment process, but at least part of it. Is that your understanding?
Yeah, that's exactly right, Scott. A big thing in understanding coronavirus treatment or the therapeutics for coronavirus is the appropriate timing and the appropriate patient. So there's all these different diagrams and sort of general understanding of how the course of COVID goes. And people, you're in your viral replication phase and feeling unwell, and then you kind of get into this inflammatory phase, and then this convalescent phase, and then even a secondary inflammatory phase, which we've certainly seen at our hospital and others are describing around the country. And for convalescent plasma and remdesivir, it seems that the earlier in the treatment, as you can imagine, if you can halt that viral replication and prevent that patient from ever getting into that pro-inflammatory phase, the better. So the data is looking like patients who are maybe with severe coronavirus infection, meaning they're maybe in the hospital and on oxygen, but not to the point that they're needing respiratory support through a high flow nasal cannula or on non-invasive ventilation or even ventilated or on ECMO. That the patients who are a little bit earlier in their illness probably benefit the most from convalescent plasma.
I got it. Thank you very much for explaining that to us. And Dr. Philpott, I wanted to ask you too about some of the long-term effects of COVID as we're hearing more about patients who have come down with this and recovered, which is great, and we're all thrilled. But many of these patients still have other long-term health impacts from dealing with COVID. They're not maybe 100% like they were maybe before catching the virus. Is that something that we're still hearing about?
Yes, we are, Scott. That's exactly right. And I think that's the most concerning thing about it. In fact, I was just talking to a friend the other day who had coronavirus early in March, and he said, yeah, I was sick for a week and a half, but I still feel bad, like not back to his usual exercise tolerance. And he's a young, healthy guy in his 30s. And we're really seeing that across the board. So even people with mild or moderate illness who never make it to the hospital are experiencing some of these long-term ramifications of the virus. We don't know what exactly yet. There's been some very interesting cases that we've discussed. I work with our COVID to home team, they're called, and
right.
I think we had Rebecca French on before and talked to that group as well. But it's very interesting as well as very concerning what some of these patients are experiencing weeks to months after having COVID-19 infections. And again, these people aren't the ones necessarily that were in the hospital and on the ventilator, but they're people who just, stay home and work their way through the illness, but are still dealing with stuff. We are waiting, we've talked a lot about establishing a multidisciplinary clinic to help support some of these folks who have recovered from COVID-19 but are still having various symptoms. And we just don't have enough data yet to say we should get pulmonary function tests on these people, or we should get echocardiograms at these routine intervals, or repeat CAT scans. There's some general guidelines out there on how to work these folks up, but really it's just still evolving, and we're yet to see kind of what is going to be the most helpful to folks who have recovered from coronavirus but are still experiencing significant shortness of breath or chest pain or confusion. There's been a lot of delirium or prolonged delirium cases. There's been some interesting recurrent lymphadenopathy or enlarged painful lymph nodes, which to me suggests kind of an autoimmune process. So I think, it's an absolutely fascinating virus, but I'm so hopeful that we're going to figure out treatments and really nail down what it's doing. But to date, we just don't have all the data and info yet.
Right. And that leads me to my next question, Dr. Philpott, which would be the work on the vaccines. And I know it is something probably that you're reading through the medical journals and things like that. We have a lot of companies, a lot of countries around the world that are working feverishly to try to find an effective vaccine. And some are in some trial stages now with groups of people. What are you hearing in your circles and your optimism for some good treatments here soon or in the next 6 months? I don't know.
Yeah, I think, there's a lot of great stuff going on out there. Scientists have really stepped up in governments and have organized this to happen at breakneck speed. I think, our state, who's been extremely, organized and coordinated with their various groups and expert teams throughout this whole pandemic, is starting to look at that and talk about that and understand how the vaccine will be distributed, how many vaccines the state of New Mexico may be allocated, and how we can go about a systematic distribution of the vaccine to those at highest risk and highest need. So I do have confidence that that's going to happen in a great or very productive, optimal sort of way. As far as the timeline, I've heard various things. There are several in phase 3 trials right now, which hopefully will come out sometime in early 2021. So we'll see on that front. I think the one thing worth pointing out is There's phase 1, phase 2, phase 3, to phase 1, phase 2. There are rigorous standards required to complete phase 1, phase 2 trials for vaccines. And I think it's important for the public to know that there were no corners cut on that. And I think, it will be interesting to see what our population decides to do, both with the coronavirus vaccine as well even as the flu vaccine this season. I would, a person having watched people die from this for months now, I would not hesitate to get a vaccine for myself, my parents, my children. I think, it is up to our scientific community to ensure its safety at this point in time. And I have confidence that we're going to come through on that. But I know, people have various beliefs and understandings and news sources even. And so I just am hopeful that the American public will really try and look at it objectively from reliable sources and do the right thing for themselves and their families, whatever that might be.
Sure. Well, and again, with all the testing that's being done, we are fairly confident that the system is in place to produce this safe and effective vaccine once it's released to the public, as you mentioned. You mentioned the flu vaccine, Dr. Philpott. I know flu season is approaching, and so I imagine that has to have folks in your line of work just kind of holding your breath to wonder how bad it's going to be, or maybe it won't be as bad since we're now all washing our hands and staying away from each other and 6 feet apart and wearing masks. So I don't know if we're going to have a good flu season, a bad flu season, but one thing's for sure, the advice is still to get a flu vaccine, right?
Yes, that's absolutely right, Scott. And I think this is a really fascinating topic of discussion that we can talk about and speculate about, 24 hours a day till flu season starts. We just don't know what's going to happen. But what we do know is that the flu vaccine significantly impacts flu cases, hospitalizations, and deaths. And I think that is the most important thing for everyone to understand when we talked about flattening the curve a lot with coronavirus. And that the essence of that is that we reduce the number of cases or people that require hospitalization as not to overwhelm our healthcare infrastructure and have unnecessary mortality or people dying that otherwise wouldn't have died if they had medical care accessible. Our hospitals across, depending on the severity of the flu season, are stretched across our country normally. So if we have a bad flu season plus coronavirus, I have a hard time even thinking about it. Honestly, it's just overwhelming. Just envisioning the sadness and what we're going to have to go through. So I think this year, this year of all years is the most important year to get a flu vaccine. I personally had neglected to do it promptly one year, and one of my children got flu A when he was 4 and ended up at Children's Hospital with a rare complication. And, I think all of us do that. It just is not on the top of our list sometimes to get in and get that done. And I think it must be this year. I think it's going to be even more challenging for people to get it in a convenient way because we're not seeing as many in-person clinic visits. They've seen that over the few months, I think it was March into June, that actually pediatric vaccinations went down 20% just because you weren't incidentally bringing your kid into clinic or you weren't scheduling that well child visit. And I think we may see the same thing with flu vaccines. If you don't get in to get that ankle checked out and just kind of incidentally grab your flu vaccine while you're seeing your doctor, you may not get it at all. I think there's speculation that some older folks who need it the most are a little bit nervous about leaving their house and going to a pharmacy where they normally get it or their doctor's office as well. And therefore may not get it. There's some interesting data actually, and a lot of recent publications on this. The Southern Hemisphere is actually having a more mild flu season, which is interesting. And we don't know if it's just truly a mild flu season, if it is more mild because people are doing rigorous, social distancing, mask wearing, hand hygiene, et cetera measures. Or we don't know if people are just kind of getting lost in the shuffle of COVID and they actually have flu. So I think we're still waiting with bated breath to see what happens with that. And hopefully we'll have that same reflection here in our flu season. There is some interesting data out. It's still preprint, so it's not been fully vetted and looked at by scientists and for its completeness and proper evaluation. But there is some newer data that shows that a physician or scientist went back and looked at people who had gotten a flu vaccine over this past season and actually found that the morbidity and mortality was lower with COVID-19. So I think that's super interesting. And correlation is not causation, so we don't know if that's truly the effect of the flu vaccine itself or if it's some other factors that are at play there. But I thought that was a pretty compelling piece that I look forward to reading after it's fully vetted to see if truly that is a cause of reduced morbidity and mortality with coronavirus. So lots to say on that. Our hospital is currently working with the Department of Health as well as our community. We're going to put out a survey, or we recently put it out to all the different pharmacies and doctor's office just to see who's doing their usual flu vaccine clinic. We are going to come up with a strategy so people feel safe so they can come through the drive-thru and get their vaccine. And we are hopeful we'll get a good turnout because really I think even just the number that's commonly cited recently, the 2017-2018 flu season had a relatively low vaccine match. It was about 38%, and it was thought to have prevented 7.1 million illnesses from flu, 3.7 million medical visits, and nearly 110 hospitalizations and 8,000 deaths. So even a bad match season, the flu vaccine really affects morbidity, mortality, and helps, in that sense, flatten the curve to not overwhelm us.
Right. Well, Dr. Philpott, I appreciate the information, of course, and again, the whole idea to not overwhelm our hospitals and our healthcare workers, even with COVID or flu or whatever we're talking about. This is, again, another way that we can kind of take responsibility for our own healthcare by getting a flu vaccine and not having to come and see people like you and your colleagues at the hospital if we have flu symptoms. But if we have the shot, as you just mentioned, that can help alleviate a lot of these cases, even in a bad year with a match. So I appreciate your time this week, Dr. Philpott. Again, thank you so much.
Yeah, thank you so much, Scott. Have a great.
You too. Have a great afternoon. Dr. Erin Philpott, San Juan Regional Medical Center, our guest here on KSJE.